The Long-Term Care Community Diversion Program is designed to provide home and community-based services to older persons assessed as being frail, functionally impaired, and at risk of nursing home placement. Effective July 1, there will be another option available for seniors in Escambia and Santa Rosa counties. Here to explain more is John B. Clark, President and CEO of the Council on Aging of West Florida. Thanks for being here.
Thank you for asking me. I appreciate it.
Well, you always have all the information here, and thanks you for sharing it.
Sure.
I know over the past couple of years, there's been expansion in our area of a program called nursing home diversion or long-term care diversion. What exactly is a nursing home diversion program?
Well, for many years, for probably 30-plus years, Florida has had a whole array of community-based services funded by multiple sources, such as state general revenue money, the Older Americans Act, and so forth and so on. Several years ago, the state began a program using private HMOs and managed care organizations to provide these long-term care services. And they call that program the Nursing Home Diversion Program. This area didn't have many of those programs, primarily because there were so few people that would be eligible, and of course, private HMOs and managed care organizations, I mean, not that there's anything wrong with that, but their bottom line is to make a profit. And there were bigger profits to be made in South Florida and Central Florida, where there are more people who would be eligible for the program. So for many years, we didn't have that program in this area.
Well, let's clear up just a second. What is meant by actually diversion? How is that term defined here?
And that's a good question, because really and truly, we like to say, those of us that have been in the business for a long time, that the state general revenue programs like Community Care for the Elderly, the Older Americans Act, were providing similar services to what is called the Nursing Home Diversion Program. But what we've always been about is diverting people from having to go into a nursing home. I mean, we know that people want to stay in their homes. We know that that's a better way to help people. And we also know, too, that it's cheaper in the long run if you can keep a person in their home with just a few basic services versus going into a nursing home on a continual basis.
So this is to care for those individuals in their own familiar surroundings.
Right. Correct.
So exactly how does the program work?
Well, first of all, a person has to be eligible. They have to be on Medicaid, and they have to be eligible for Medicare Part A and B. And the person has to be at some risk of going into a nursing home. They have to be properly assessed by the state as meeting that level of nursing home care. If they do, they could choose. Right now, it's their choice to go into one of these nursing home diversion programs. That basically is how it works. Now, in terms of the funding mechanism, that's a little different. The way the funding mechanism works is the state of Florida provides the nursing home diversion program so much per member per month, like an HMO. Like you may be you are in a private HMO. Your private HMO gets so much per member per month to care for that person and provide these long-term care services. The result is, if this person can stay in the home and not have to go into a nursing home, and the diversion program can make money. If they have to go into a nursing home and the HMO has to pay for that cost, well, they could lose money because they get a capitated rate to provide all the services.
So what is the relationship with agencies like the Council on Aging or other peer organizations around the state? What's our role in this?
Well, for a long time, and we're going to talk about it in a minute, I'm sure, about the program we have with WellCare Children's Hope Society, but for a long time, the relationship was purely contractual. In other words, these diversion providers, these private HMOs, would come into a community, they would meet with agencies like ours, and they would say, well, do you want to contract with us to provide homemakers, personal care, daycare, and so forth? And then the provider or the agency like ours would say, yeah, we'll do that for you. And we would contract with them, and they would provide the services, and the HMO would simply contract with that local provider.
So tell us about this newest program that involves WellCare.
Well, WellCare has recently been approved for expansion into Escambia and Santa Rosa County. We're kind of excited about it because about 3 or 4 years ago, we began meeting with the Children's Home Society of Florida. And when we talk to people about this, they roll their eyes like, why are you working with Children's Home Society? Well, Children's Home Society is a statewide organization. They're a large organization. They have a lot of state credibility. They have a great infrastructure around the whole state. They recognized that in this part of Florida, there was no nursing home diversion programs. And so they began meeting with all the agencies like us in this area, in Santa Rosa, Walton, and what we call District 2, which is Bay County, Wacalla, Washington, Holmes. And they said, we need to all get together and form our own nursing home diversion program, apply to the state, get funded, and then we can provide the services through our agencies.
So does that mean, like, say, for example, one of our clients who has an existing case manager and they've built up a relationship with that person, they might be able to continue working with that person?
Well, correct, but there's one more step that occurred. Even though the Children's Home Society and our agencies were working to do that, we were going to submit an application to the state to become a diversion program. Several of the HMOs that were interested in coming to this area said, well, wait a minute, we'd like to be part of that relationship. And so these HMOs met with the Children's Home Society, and they had to select one of those HMOs, and they selected WellCare. So there was a partnership formed with WellCare, the Children's Home Society, and the agencies like us, like the Council on Aging, throughout this area, Northwest Florida, to provide those services as a diversion program.
Okay. Well,
And yes, you're right. I'm sorry to go back. That means if once that diversion program with WellCare gets started, hopefully in July, and a client now that can choose that as an option, yes, it will mean that they'll be able to stay with a familiar case manager. Correct. That's a good point.
For a lot of people, that's,
oh, yeah.
that's a big plus.
Right.
So how effective have these kind of programs been around the state or even in this area?
Well, they've all been effective. The legislature has this department called and I'm going to screw up the name, but it's called Office of Program and Policy Analysis, OPAGA. And what OPAGA does is it looks at all of these state-funded programs to determine how effective they are. And they looked at the nursing home diversion program, and they looked at the programs we were providing before through the state general revenue program. And they said that all of these programs were very effective in keeping people out of nursing homes and saving the state funds, money. The difference was, of course, is that these programs had different levels of funding. So the nursing home diversion was the most heavily funded, whereas the state general revenue programs were the least funded.
Okay. Well, thank you for sharing that information with us. I know it's a lot to understand, and we'll be putting out some other information, but we wanted to get that out there, so thank you.